Well, I am excited today. I'm Melissa Cady, the Challenge Doctor. I'm here with a returning guest, Joe Tatta, who I had the privilege of interviewing, I think it was 2 or 3 years ago, if I'm not mistaken. And he is the founder of the Integrative Pain Science Institute. You can find that at .com. Go ahead and put those words in. He's an author, a nutritionist, a physical therapist, and a pain educator. And I just really love the work he's been doing and really sticking to it and helping people out there in an online space, especially. There are so many ways to consume his content, whether it's on listening to recordings or in a book, in interviews. I just think he's doing a lovely job. So please welcome my wonderful guest, Joe Tatta. Thank you for joining us today.
Hi, Dr. Cady. It's great to be here with you again.
Awesome. Well, I just really wanted to bring you back and give people a little snippet and to understand what your background is or kind of what led you to this place you're in now. And then just a couple of things I wanted to highlight that you're doing. Would that be okay? Just give them a little background.
Sounds like a great place to start.
Well, let's see. You started physical therapist first, I'm assuming?
Yeah, so I graduated as a physical therapist. That's back in, let's see, Melissa, let's go back.
We're not counting.
1996, no one's counting. Yeah, so I'm trained as a, physical therapist and did that for many years and still do that. And still those skills are vitally important. Yeah. But as most of us who work with people who have persistent pain notice that there's a lot of other things that are going on. Probably my first foray out of the traditional allopathic physical therapy model that both you and I are probably a part of, was venturing into nutrition and seeing how nutrition had really deep and positive impacts on people's health as well as their pain. Yeah. So I studied nutrition. I still study nutrition. I actually just engaged in a research study last year that looked at nutrition for chronic pain specifically, and what do we really know about it, and what can we kind of really point toward and say, hey, this does work for nutrition. This does work for people with chronic pain, and it really does, especially with regard to certain conditions. The top one being fibromyalgia, the second being autoimmune disease, and then of course, all of those have in common neuroinflammation. So that's a big part of what I still do and a big part of who I still am, so to speak, as a professional, as a practitioner. I got a little bit involved in pain education because I realized that there was a cognitive aspect, a cognitive behavioral aspect of pain that was important, but I never went too deep into that because I realized that really what pain education did, and these are great minds, people like Laura Mosley and Adrian Lowe, they really took aspects of what's called psychoeducation from traditional cognitive behavioral therapy, and they built it out into larger treatment interventions. And I watched this happen over the course of many decades, and I started using it myself, but I was very cognizant of the fact that important, but not the great kind of outcomes that people think might happen from it. And the reason why that's not happening, really hasn't happened, is because pain is multifactorial. So we need more than one, or what they call multimodal interventions. So really, I kind of ventured into what are called the mindfulness and acceptance-based approaches to pain. So really those three right there. So talking about physical therapy, which involves obviously manual therapy, exercise, the promotion of physical activity, mindfulness and acceptance-based approaches, and nutrition really are kind of my bread and butter at this point.
Yeah. I'm curious. I don't know if I've ever asked you, but in the nutrition realm, was it because you thought that nutrition was related to pain, or was it just you're interested in nutrition and you started recognizing the importance of the two?
Yeah, that's a great question. It's funny because I actually wound up in the nutrition space based on more of like a health and fitness approach, because I had a lot of clients I had when they were done with physical therapy, they wanted to continue like their health program, so to speak, to continue a wellness program. So really it was more centered around weight loss, if anything. Yeah. And then as I started just delving into the nutrition science, I started making these, what are now clear connections, or what we call associations in literature, with regards to inflammation and nutrition, and then inflammation and chronic disease. So when you look at all of the non-communicable chronic diseases that we see today, metabolic syndrome, diabetes, obesity, cardiovascular disease, did I say diabetes? Even things like depression, yes, which is a non-communicable disease, all of those have bi-directional relationships with pain, and they have very, very strong associations with nutrition. So I wound up in nutrition more from like a health and wellness perspective. And now most of my focus really sits in the chronic pain perspective.
Yeah. And so a lot of what, you were in that traditional space, and not everyone uses that word allopathic, because of course, as a DO, I kind of use that terminology too, but there is a very traditional path in that allopathic world. And that's a lot of what I think society sees, and that's what they come to expect. They don't even know anything different. It's just kind of a knee-jerk reaction. You do this for this and whatnot. But you shifted into this online space to try to bring knowledge or coaching or help in some capacity to people. I'm curious, through this journey of yours, what is like the big picture realizations you had of what might be the most helpful? I'm not talking about specific data and research, but looking at all these different realms of people's answers to pain, what is like the big gist of what you've learned that maybe gives people a little bit of hope? Doesn't take away the work, but what do you think it is you've learned through this?
What I've learned through this experiment that both you and I are
Yeah.
really engaging in together, Melissa, because the work that you're doing and the work that I'm doing essentially is the same. We essentially have platforms that are, in a way, public service announcements.
Mm-hmm.
They're public service announcements for people with pain, and they're public service announcements for practitioners that are looking to learn more. And what I've learned through this experiment that's gone on now for almost 3 years, I have probably about 260 podcast episodes, maybe more by the time this is done, and I have courses for professionals, is that we have done a really good job at kind of evaluating and assessing pain and looking at all the different components of it and analyzing it. And as practitioners, as licensed health practitioners, that's kind of where we start. Like, we want to evaluate things, we want to figure it out, and then we want to kind of cure it or solve it.
Mm-hmm.
That's a very close myopic view of pain.
Yeah.
If you step back, way, way, way back from really where we're currently sitting, pain is a tremendous public health concern.
Mm-hmm.
And not only is it a tremendous public health concern, it's actually a human rights issue, because everyone has the right to access and to safe and effective pain care.
Yeah.
So when we start to look at pain as a public health issue, it really changes the entire lens of the work that we're doing. And knowing that, look at the stats, right? A third of all Americans, or 25% of Americans, depending on what study you look at,
Mm-hmm.
struggles with chronic pain at any given day. That's a tremendous burden that our healthcare system has to take on. It's a tremendous burden that our financial system has to take on. It's a tremendous burden that we take on as professionals. And of course, it's a tremendous burden for the individual with pain. And what I'm so curious about more and more is, we don't have enough licensed health professionals to treat pain effectively. We don't have enough PTs. We don't have enough physicians. We don't have enough psychologists to really help people out there. So if we can't do that, and of course, we will continue to make huge strides and leaps in the clinic, so to speak, right?
Right.
But if we don't have enough, then we have to turn to public health measures to help the public increase their self-efficacy, right? Mm-hmm. Their ability to self-manage their pain in a way that's efficient and in a way that's cost-effective. And I do think the means by which we're communicating now is an effective way to do that. The only challenge is sometimes education alone isn't enough for behavior change. Mm-hmm. So they're interesting topics for us to, think about and to reflect upon as we grow our platforms and as we grow our podcasts and as we work with patients one-on-one.
Yeah, which is a great segue into, as the challenge doctor, there's I play on a lot of things there, but you can see the word change within the word challenge. You can't really change without challenging yourself. You got to build resilience by challenging yourself. There's like so many elements of that, but all of it comes down to lifestyle. And I know you are, that most definitely. I know you have some work coming up in that area as well. I mean, you already do it in multiple ways, but that lifestyle change, even though we know we shouldn't be smoking, or we shouldn't be, doing nothing. We should be doing something and moving. I think the question is, if we're reaching out there and trying to help people, then just saying to teach so they know, that's not necessarily enough. And I guess I think this is the $1 million question. How do we truly, with everything you've been doing, how do we truly help people? It seems like you almost have to hold people by the hand and coach them and see the little nuances and the idiosyncrasies and all these things that in their view, it's hard for them to see it, or they don't understand why they're doing it. So I guess, have you found little like pearls, or not necessarily things, but like these processes that have maybe helped people the most?
I have. Our responsibility as licensed health professionals is, one, to help someone rev up behavior change, rev up that motivation for behavior change. Like, that's a big part of what we do.
Yeah.
Whether you realize it or not, when someone comes to see you, they're basically saying, hey, in some way I'm ready to make some kind of change. How can you help me? How can you motivate me and can help me continue with that change? So revving up the motivation for behavior change is like the first step. And there's lots of different ways to do that. The second is providing people with these little tiny habits that are achievable and sustainable for them. Because as you mentioned, Melissa, like if you look back at all of your episodes and podcasts, a lot of information there.
Yeah.
And you and I understand that because we're licensed health professionals with, advanced training and degrees, and we continue our training, right? So we're constantly submersed in this sea of information, but our patients aren't. And even if our patients are submersed in information, they're just getting kind of like a smattering of things through like, a 2-minute segment on the Today Show and a non-evidence-based blog that comes through their Facebook feed. So it's really challenging for them. Yeah. So we have to provide them with the information in little tiny habits, little tiny steps that can help them with that behavior change that I first mentioned. And then probably the bigger part is why is the patient engaging in this? And in some ways, why are we in this container with the patient, helping them engage in that activity? And most of that revolves around helping people connect to deeply held values that they have. Once you can connect someone to their values, things that are really deeply and personally important to them in their life, then that's a really good way to kind of rev up and sustain that behavior change. And that's why I started studying things like mindfulness and acceptance-based approaches, because they have an intentionality about them, those approaches, and they have a very values-forward approach to helping people with chronic lifestyle conditions and specifically chronic pain.
Yeah, you reminded me of something that I'll probably be presenting in a little online conference, and the topic I picked was essentially addressing the clinician themselves and their beliefs, because their beliefs are making an impression on the other beliefs in front of them. And if the beliefs they have are not helpful beliefs, then you are kind of stagnating the potential progress or, success of the person in front of them. I think that's kind of where we're at a lot in our medical environment, especially with traditional views of pain and how we're going about treating it. What are your thoughts about my comment about that? Does that seem in line, or do you think differently?
I love your comment. And one of the reasons why I studied mindful and acceptance-based approaches is that, first of all, they take a non-judgmental stance toward essentially everything that you're engaged with. If you're walking into the treatment room, so to speak, right? If you're walking into the room with your own preconceived thoughts and beliefs about what pain is, what's caused it, and what someone's recovery should look like, in some way you're biasing that interaction. And in some way, you're now not allowing that natural therapeutic relationship and that natural bond to develop. And what's really interesting, Melissa, is that when you look at the literature surrounding chronic pain, all the things related to lifestyle, all the interventions that we have, surgical interventions, all of the medications that we have, there are still conditions out there, and there are still people out there who don't respond to them. Yeah. Despite having been introduced to all of them in very very meaningful ways. So that's where the acceptance and mindfulness-based approaches started to come into my treatment, because these are the patients I'm seeing. Patients come to me and they say, hey, I've tried cognitive behavioral therapy. I've seen a pain psychologist.
Yeah.
I've had an injection in my back. I've tried a paleo diet. I go to yoga class 3 times a week. So I'm doing exercise, but I still have pain.
Mm-hmm.
So instead of changing pain, or us as professionals holding on to the story that I can change someone's pain, what happens if I just become a little bit curious and I just start to interact with someone and their pain in a way that's not judgmental, and say, hey, if we can't change this pain, let's see if we can relate to it differently.
Yeah.
Because chances are, even if I alleviate your pain today, it may come back a week from now,
Mm-hmm.
or it may be gone for years and decades, and then another pain may come back into your life, because pain is part of our human experience. And if I can teach someone how to cope with pain effectively, how they can relate to pain in a way that doesn't cause them to have incredible amounts of anxiety and fear, and to really close down, for their own whole entire life to close down, then what I've done is I provide someone with really life altering skills that they may not learn in other places. So when you say that as professionals, we hold on to beliefs, that's true.
Mm-hmm.
And it can be really difficult and challenging, especially when you have these big initials after our names, which all of us have, and to say, you know what? I don't think I can actually change this person's pain. That's a very sobering moment for a professional, to say, okay, if I can't do that, then what's the alternative? And now those alternatives do exist in many of the contemplative mindfulness and acceptance-based approaches that are out there. And
Yeah.
they're evidence-based and they work for people.
Yeah. It's interesting. I love how you said, be curious. And you're almost reflecting back onto your client or your patient, that you're kind of role modeling that, even be curious about your own pain, instead of this is all it's ever going to be, and kind of being pessimistic or perseverating about it. Like, instead, in that state, though, of course, it's the hardest thing to do. But if you can be curious enough to explore multiple possibilities and know that it's not just the thing that's offered to you that could be changing your pain long term, that it's maybe some of the various things that you need to trial out and try to see if it helps. I really love the idea of being curious, because I think when you say self-efficacious, or people have self-efficacy and can manage it on their own, that's essentially, you have to have an element of curiosity to be willing to explore things that actually create belief in yourself, that you can help yourself.
That's right. So far, we have taught people who have pain to, in essence, what you have to do to overcome pain is to control it, to eliminate it, or to avoid it.
Yeah.
And those 3 words there, that control, elimination, or avoid, is a very closed perspective, right? So if you use the body, right, because I'm a physical therapist, I use the body with almost everything I do.
Mm-hmm.
A closed perspective, or an avoidant perspective of pain, is something that kind of looks like this.
Mm-hmm.
So for those of you that can't see, just listening to this, my fists are up, my hands are in front of my face, my posture is very rounded and hunched over, my shoulders are protracted forward, and it's a very closed posture, right?
Yeah.
So how can you negotiate life when you have not only a closed physical posture, but also a closed psychological posture, if you will, toward life?
Mm-hmm.
So many of the places I start with people who have had long-term retractable pain is just what's called an open posture.
Mm-hmm.
So right now, my hands are just spread out to the side. My
Mm-hmm.
chest is lifted a little bit. And I'm wondering if I can be a little bit open to the things I'm experiencing, because being closed down to them and taking a stance of struggle and elimination with this pain hasn't helped me. And in essence, the more I struggle with pain, for some people, the further it takes them down this trap of pills and surgeries and things that really don't work for people in the long run. There's a place for that sometimes, as you well know.
Yeah.
But for many people, they have exhausted those options. And these are the people that wind up in serious trouble. They wind up with addiction problems. They wind up not going to work. They wind up disengaging from personal relationships, which are deeply pain alleviating for people. And this is what, in essence, impacts our human experience. So if I can help someone be more open, aware, and engaged with life, through that open awareness and engagement with life, they interact now with the things they love, the people they love, the things they love to do, right? They start re-engaging with that. And what's really interesting, Melissa, we know that a brain that's engaged with meaningful activities is one that feels good, right? When you're engaged with meaningful activities, you feel good. If you feel good, then pain can't be present. So in a lot of ways, we've kind of put the cart before the horse, so to speak. And we said, pain has to go away first, then you can return back to life. Where my strong stance with people is, I really want to know about the life you had before pain started. I want to know the little baby steps we can take to return you to that life. And I can almost guarantee you, once you take significant steps in that direction, pain may not go away 100%, but I can pretty much guarantee you it's going to alleviate enough so that's no longer a major concern that's on your mind day in and day out, and you can return back to doing the things you want to do.
Yeah, I love that. And I really like the idea of, and I've heard other people say it, but I feel like pain is a teacher. If you're willing to, listen and be curious, like you said, and explore with open arms, what it is maybe that's trying to teach you. You could, and I don't mean that from, what your beliefs are in religion and whatnot. I mean, just in general, you can look from a physiological standpoint. There's information that sometimes creates a painful experience that's helping avoid injury or trauma or whatnot. So I think in general, we talk about lifestyle, how that's a critical component to managing or dealing with or alleviating, depending on your situation, pain. But these lifestyle choices can be so challenging for some people, and I think I've struggled with. At times, people feel it's that same thing, immediate gratification, and recognizing that there's lessons to be learned, that there might be certain things about your lifestyle that might not be completely clear right now, and without exploring it, it might be hard to figure that out right away. But I guess sometimes those changes, those small changes, those small habits, they don't always give you that immediate gratification. And I'm curious, because it always seems like a struggle to try to convince people that sometimes it takes time. I mean, I can appreciate as a health professional that the body's amazing, has adaptability, and it can take time. Even healing, or when you first injure yourself, you think it's never going to go away, and then it heals, and then your pain goes away most of the time. How do you deal with that situation? Before I get into your book, I wanted to ask you about that, like long-term small habits. How do you convince? I don't want to say that word. How do you encourage people to understand that this can be a process?
So I take someone through an aspect of acceptance and commitment therapy, which is called creative hopelessness. And it's a funny term. And the word hopelessness tends to make people feel like, what is this really about?
Yeah.
But in essence, this process, this essential process in ACT, or what's called acceptance and commitment therapy, is a process that you guide and counsel a patient through. And it takes a little bit of time. You sit down with them and you say, hey, let's lay out on a piece of paper and let's look at all of the types of interventions you tried. And for some people, this can be many, many items long. I've had patients where it's been 50 to 100 items, and they list everything out. Both those that are beneficial, things like changes in diet and exercise, and then those that may have not been very beneficial, like, I don't know, the electronic gizmo they saw at 2 a.m. on an infomercial that just didn't do anything at all.
Yeah.
But when you lay down these interventions, if you will, and you ask them, okay, what provided you with short-term relief? And for a lot of those items, people say, well, yeah, massage provided me with short-term relief. The injection provided me with short-term relief. Those special exercises, the physical therapist provided me with some short-term relief. And then you ask them, okay, what about long-term? What's really helped you with long-term relief? And most people will look at that list and they'll say, well, nothing. Because if I found long-term relief, I wouldn't be here right now asking you for help.
Right.
So you really come to this really pivot point, this watershed moment, if you will,
Yeah.
where they realize nothing has worked for them with what you're talking about specific, Dr. Cady, that instant gratification of like almost turning off that pain switch, right? Almost like we have this light switch. We
Yeah.
can turn it on and off. And wouldn't it be nice if we had that? But in many ways, because pain is both a physical as well as an emotional experience, we can't turn emotions off, right? You can't just turn anger off. You can't just turn happiness off, right? And pain is the same way. You can't just turn it off. So over time, there are lifestyle interventions that help us ratchet down or dial down that pain knob, that pain switch, if you will.
Yeah.
Exercise, nutrition, mindfulness, sleep, weaning off of substances that aren't helping you. Those are all important.
Yeah.
But then there's that mind aspect of it, right? How do I confront this in a way that's flexible, in a way that helps me adapt? So there are two knobs here. It's the lifestyle, and then it's our approach, basically. And when you go through it like that with people, they realize, okay, so no one can turn this off with the snap of a finger, right? No one in essence is a god and can do that. And even if we could do that, there'd be implications for turning pain off. Like you would never feel a rock in your shoe.
Yeah.
You would never feel the hot water coming out of the faucet to know if you're safe or not. You would never feel when you twisted your ankle in that, pair of high heel shoes, so to speak.
Yeah.
And conversely, if we can turn emotions off, then that would also mean that you probably wouldn't feel the happy emotions that we all experience, like love and joy at different times in our life. So it's a process, Melissa. It's a process that takes counseling and takes time. Doesn't always happen over one session. Sometimes it takes a couple of sessions for people to arrive at that place. But that's really what we do with, our work in mindfulness and acceptance-based approaches to pain.
Yeah. You make me think about those moments where I'm trying to be really patient and I feel like, I've said all I could say, and I have to deal with my internal feelings of frustration, or not that I want to express frustration to the person, but I just want them to get it. and I have to like manage myself because I want them to get better so badly. And I want them, to get to that place of, relief. And I think there's a lot of clinicians out there, just even in the traditional world, that don't even kind of get this conceptual big framework we're talking about, that we get to this place where it's a struggle from within to have that patient. Joe, you have to have patience for this process. So not only do you need the clinicians, which we don't have enough of, but we need patient clinicians with the knowledge and understanding that, you have a lot of different skill sets to understand even the psychology behind how people are, breaking down these possibilities of change and how you create change. And so, first of all, kudos to you to take it upon yourself to learn these various aspects, because there's not that many, and I'm sure you agree, there's not that many people out there that have all the different backgrounds that you have.
There's not. And, that's the focus of my work currently,
Yeah.
is to train more professionals on this. Because when you look at the research, everything points toward multimodal treatments, multimodal treatments, multimodal treatments. Okay. What people first think about when they see that is, well, we need a multidisciplinary or interdisciplinary teams to treat patients.
Yeah.
So yes and no. And let's talk about that yes and no, because they're important.
Yeah.
So yes, we need more multidisciplinary pain clinics throughout the globe, and especially in the United States of America, because we don't have enough. However, they are expensive to staff. That's first, because when you have to staff an interventional pain physician like yourself, and a physical therapist, and a psychologist, and a social worker, and a nurse, and an OT, and a dietitian, and a health coach. Who am I missing, right? Did I include everyone?
Yeah.
That's all extremely expensive. And in the country we live in, unfortunately, the insurance companies are looking at the bottom line.
Yeah.
So that's first.
Yeah.
Second is that type of approach is not appropriate for everyone.
Right.
Who wants, first of all, those are very time intensive approaches.
Yeah.
So you'd have to have someone who's not working, so to speak,
Right.
which when someone's not working, that sets up barriers to care in lots of different ways,
Mhm.
especially with regard to your insurance. So I'm the most interested, and I have a program coming out on this in a couple of months, but I'm the most interested in how do we train practitioners in deeply effective evidence-based ways to deliver multimodal care. Because I'm convinced through my experience, Melissa, is that at this point, I can pretty much train any licensed health professional who's willing to spend some time and dedicate to learning what all of this is really about. I can train any licensed health professional to deliver that kind of care. Now, yes, there may, and there definitely is a time to refer to a PT for if they need extra exercise and movement, or a psychologist if that person has, for example, a personality disorder that's beyond someone's scope of practice.
Mhm.
But really, the interventions we're talking about really fall within a health behavior promotion approach to living. And every professional should have those skills, and every professional should know how to counsel people with pain on those essential skills, because it's more efficient when it's done with one person. The bond that's created with one person is oftentimes much deeper than in team-based care, which team-based care can actually burn a patient out, actually, because you're with too many people, and there's too many personalities happening, and they're cost effective. So those are the things that really interest me.
Yeah. No, I love that. And it was just making me think of actually in your book, I'm in the middle. I haven't finished yet because I've put too much stuff on my plate, but it is awesome. I got to do a little, let me see if you can see it with my, here we go. Radical relief. And the thing is about this is that there are so many, and before I get into this, there's a lot of health professionals out there that aren't well trained and understanding these multi-dimensional aspects to pain. And they all should learn it because they themselves can endure pain that may be challenging. And who doesn't show up in their office complaining? I mean, most of them will have someone complain about pain. So, I mean, pretty much everyone is, could benefit from your training or just diving in a little bit deeper into it so they can be a little bit more effective. But I really love, so it says a guide to overcome chronic pain, radical relief, a guide to overcome chronic pain, return to a full active life using pain science, mindfulness, and acceptance and commitment therapy, or as some people hear, ACT. But what I really love, especially because you talk about little tiny habits and, people have a lot of pain. They don't have maybe the attention span to like go through heavy chapters, like maybe some of the chapters I wrote in my prior book. But I think it's really great because you have like 1 or 2 pages that, each day you can, take a look at and reflect on. And I love what you've done, and I'm looking forward to finishing your book. But obviously, you can find out more about his book by going to the integrativePainScienceInstitute.com. But I just think that we do need to do something in a public service way, and I do like the bite-sized information you give for people that are challenged by pain. But I do think we all feel kind of this obligation when we are realizing the way we're doing things is not the best way, and all the complexities of trying to have multiple people in one clinic, and it's not really efficient and it's expensive and all of that we've got to get a way to help inspire and give hope to people so that they feel like they can manage their own pain. I can't tell you how much just certain movements and mindset, I even do little videos of how I talk to myself when I'm encountering some kind of pain challenge and how that drives my behavior. So my beliefs, of course, are very driven into, I can change anything if I'm patient enough, or, just give it some time. And so that, of course, drives some of my thoughts, and then those thoughts drive some of my behaviors. But I can tell you that I'm a very physically oriented person. And so doing things physically in a certain way or changing how I'm doing things changes my experience of pain. And that gives me a sense of confidence that not just in that moment, but in the future, that I will find a way. Now, there's always those little doubts that creep up from time to time, but I try to push those down and have a pretty optimistic person. But I know that there are people that are not so much. So, I hope that we can drive bigger messages across bigger parts of the population. It is tough because of the belief systems that we have kind of in our system. But any thoughts on some of the things I'm saying there? Because I know I'm going off on a tangent from your book, but anything you want to say about your book and its intention?
Well, I appreciate that you noticed the small chapters in the book. So the book has 36 chapters, but it's only 100 pages long. And through my experience, my almost 3 decades of experience working with people with chronic pain, I realized, hey, they do much better with these, as you said, bite-sized little tiny changes. So each chapter in that book is like 1 or 2 pages. And I give you one little exercise to do that promotes cognitive change that you need to support the behavior change that you're talking about. I think we can also apply those principles to everything that we do within regard to our clinical practice and the public health messages that we deliver. So for example, when I set out to do a podcast now and I'm talking to a guest like yourself, I make sure to very intentionally have something in that podcast that I call out as like, hey, here's the small little step today that you can take to move yourself one step closer to a life without pain. Because so often people listen to the podcast and like, well, that was really great. I really enjoyed Melissa. She's cool. And Joe's great, but I don't know what to do now. So I really am intentional about, hey, here's what I'd like you to do today. Right.
Yeah.
And it could be something as simple as, so for example, in mindfulness, there's a little acronym called STOP, which is literally stop, take a breath, observe any thoughts, feelings, or bodily sensations that you might be having, not judgmentally, and then proceed.
Nice.
And I've had patients do that. So I tell them, do that 3 times a day. Do it in the morning, do it in the middle of the day, and do it again in the evening. Just stop. And it literally takes maybe 20 seconds at the most to do that. And I've had patients come back to me and say, that exercise has been really life-changing for me because I realized like most of the day I'm going like a bat out of hell. I've got this like list of to-do things happening and I don't realize how it's affecting both my mind and my body, which in essence are one, how it's stressing me out and how that stress is having an impact on my pain. So it doesn't have to be like, for example, people in our space, so to speak, are very tuned into the psychosocial aspects of pain. That doesn't mean someone needs a 14-session cognitive behavioral intervention. It means that you as a practitioner just has to take into consideration that there are psychological factors or psychosocial factors that impact someone's life. And if you can impact those in the smallest and the greatest way possible, then you're really going to be able to help someone. So everything we do impacts behavior change. Just being intentional is what all of us have to do more and what all of us have to do a better job at. And it's something that I struggle with on a daily basis because no 2 patients are the same.
Right.
Their pain experience is not the same, and the tools and interventions and ways that I help them is not the same either. So there's no cookbook, but there are good guidelines we can all follow. Yeah.
Well, thank you for giving that little stop example. So I've had it incorporated into my own podcast. No, I think it's truly amazing how people in this space have to be comfortable with being uncomfortable because there is that uncertainty with each person before you. And I think we're naturally inclined to want to help, but we also have to take the mindset that we're not technically fixers. Whether you want to call us healers or not, I think it's just being mindful and aware of all the potential contributors. And then when appropriate, you can bring up those things with patients if they have the capacity to, drive those changes if they're interested. So yeah, I think it is, you have to be comfortable with uncomfortable in the world of pain. Yeah, most definitely. Well, any last minute, I know you gave the stop example, but anything to give hope, maybe a last comment or observation that you'd like to kind of stay in people's minds when they finish this podcast, just to give them hope with maybe if they're in pain or if they're trying to help someone with pain, either one?
Yeah, sure. I mean, I think for someone, I always talk first to people living with pain and then to practitioners. But for the people living with pain, the question always is, I've had this pain for so long, can I really get rid of it? And the answer is yes. People have reversed their pain, and there are ways to do that. So just hang in there and find a quality licensed healthcare professional that can take you through that process.
Yeah, awesome. Well, and for anyone that is trying to learn a little bit more about this, there's plenty of resources on Joe's site at Integrative Pain Science Institute, which I've just really been impressed with just the evolution and growth of your site and what you're doing again. So thank you for being a guest with me, and I look forward to sharing this on everywhere I can put it for you. So it was wonderful chatting with you today.
Thank you, Dr. Cady. Talk to you soon.